side of it. And so let me introduce the Medical Concierge. This is the last idea presented by Davis and John. They're actually coming from Uganda. Davis. Okay, Davis is a certified projection manager, engineer, and health systems consultant with UNICEF Uganda. And John is a certified medical researcher. They want to revolutionize the healthcare system in Uganda with their idea. So thank you for making the trip.
Good afternoon, everyone. We have a medical concierge team from Uganda, and I'd like to introduce to you my colleague over here. He's a medical doctor and a medical researcher with one of the leading research farms in Africa called the Infectious Diseases Institute. And myself, Davis Musenguzi, a medical doctor, are working with UNICEF on developing, scaling, and evaluating e-health initiatives in partnerships with governments, government agencies, and private sector. Today, we'd like to present to you a 24/7 medical concierge call center and service. Where we come from and operate, the region of East Africa, there are major challenges to our health system right now. For instance, the first major challenge that you'll notice is the doctor-to-patient ratio, which currently stands at 1 to 15,000. For every 15,000 people, they have access to one doctor. If I could just put that in perspective, compare that to Germany, where every doctor can be able to provide a service to 300 people. The second major challenge that we have within the region are the rising healthcare costs. And this is a region where most people make their health payments out of their own very pockets. And even those people that are on health insurance are constantly seeing increasing premiums in their health insurance year in, year out. And also to couple all of that, we are seeing poor quality health services, reduced face time with your doctor. We have fragmented paper health systems. But then with every single challenge, we see an opportunity that we want to capitalize. And there are three factors that are making this possible. One, the healthcare market in the sub-Saharan region has been projected to grow up to 28 billion euros by 2016, and these projections were made by the World Bank. Not just that, but also we have seen mobile usage within the region being able to get up to 73 million in East Africa, and the Deutsche Consulting Group has projected the penetration rates to get to 80%, opening you up to 115 million mobile users. But we are also seeing increased understanding of collaboration and engagement between different healthcare partners, like patients, the consumers of healthcare, the doctors, the providers of healthcare, insurers, the financiers of healthcare, and also now with the telecoms, who are the technology providers of healthcare. And it's at that intersection that we are seeing an opportunity for e-health to be able to provide accessible, affordable, and quality healthcare service. And how is this going to be possible? The Medical Concierge is fronting an innovative solution and business model that will provide free healthcare access to any doctor that we will have at the 24/7 call center at your normal tariffs, SMS, or data. There will be no extra charges or premium rates. And this will allow the doctor to be able to provide information over the phone if this is a case that can be handled over the phone, or if the caller needs to come in for a physical consultation, be able to bring the patient into our facility so that they can have a physical consultation, or if they require ambulatory services, we can dispatch an ambulance so that they can get the necessary services that they need. Not just that, but we are looking at converting these free customers to start paying for premium service. Some of the premium services that we are looking at are web-managed ambulatory services, where we can use GPS tracking and also fleet management technology to dispatch the nearest and best available ambulance. Mobile medical devices for remote monitoring of these patients. And also personal electronic health records, giving people access to information that they own regarding their health. So we're also taking on a business-to-business approach. Our business-to-business approach involves supporting organizations that are working with communities, providing healthcare services and public health campaigns. What we are looking at doing in that space is, for example, where Dr. John Mark works, they are dealing with thousands of HIV patients coming in and congesting their place every single day, asking for basic health information that can be provided through a healthcare call center. Health insurance. I told you already, health insurance premiums are rising every single day. And why is that? They are not interfacing with the different healthcare facilities that they are covering. And what we want to do is develop applications that can improve that interface and in time increase the efficiency of their business processes and reduce health insurance premiums. We also see a huge potential for telemedicine services, with existing big hospitals and clinics that are looking to extending their reach beyond the confines of beyond their geographical confines and looking to provide services in people's homes. But then with all of this, because of all the traffic that we will be getting through our call center, we see a very unique opportunity for one-on-one advertising through our interactive voice response, where we can place any health ads on products, on services, or even public health campaigns on contraceptive use and condom use and so on. Where are we today, and where do we see ourselves tomorrow with Deutsche Telekom? As of today, we have already made an investment in a minimum viable product, which is our call center and a clinic to go along with it. And right now, we are looking at opening it, launching it officially on July the 1st, in just a few weeks. But where we want to go in 1 month's time is to be able to start the process of rolling out our model for the premium services, where we can, for all the callers that have been converted onto our premium services, can start accessing that. And we see the value that Deutsche Telekom can play in this, because Deutsche Telekom has a wealth of experience in the areas of telemedicine, in M2M healthcare solutions, transport and logistics, that we feel will play a vital role in offering those premium services. Our business-to-business approach in about 3 months, because by then we believe that we will have built the credibility and the confidence to then engage large businesses with the services that we are offering. By December 13, in 6 months' time, we can see this model being replicated in several other low-resource settings where we see suitable factors for us to be able to provide the same sequence of services. Working with Deutsche Telekom, what we want to do over here is be able to open up Deutsche Telekom to a whole new market, because in that market of East Africa, we're looking at a population of 144 million, 60% of whom are under the age of 35. They're very mobile technology savvy, and they're constantly demanding for quality services and solutions on their mobiles, on their laptops, tablets, and desktops. We believe that we can open Deutsche Telekom to new growth markets where they can be able to take advantage of major opportunities. We're not just offering Deutsche Telekom a single product or a single service. We are offering you an entire e-health ecosystem where you can deploy several different products that you already have, like the telemedicinal bag and so on. We believe that our networks can open you up to several different partnerships with governments, with government agencies, health insurance companies, healthcare professionals. And we believe that within the region of East Africa, we can provide you with the competitive intelligence insights necessary for you to deploy any products, understand the market trends in the health IT and communications industry. And Dr. John Mark and I have the true belief that we can position the Deutsche Telekom brand to be the #1 choice as a provider of connected healthcare in Africa.
Thank you very much. Questions? Anyone?
How much can actually be done via just a phone call? I'm wondering if a person like me, I have a problem and I have to explain it to a doctor via phone. First of all, will I be able to explain what I have? And second, will this doctor on the other line be able to interpret what I'm telling him? Can you give me some kind of assistance? I wonder whether this is possible.
Actually, a study was done in Europe, right here, and it was identified that there was a call center that had provided services over the last 10 years. And when they did the study, they found out that 60% of all the calls that came in could actually be handled via the phone call. Only 30% had to come in for a physical examination, and about 5 to 10% required ambulatory services. So we believe that there is a lot of advice and guidance that can be provided over phone, especially in a market where the alternative is nothing.
So the place where I work in the justice is as institute, quite a number of patients calling in to say, let's say, give me this type of ARVs. I reached home and after I took my medicines, I started them last night and I'm getting a headache. Is this normal? Do I need to come in? And I know that this is probably the initial effects of the drugs, and I know it will go in 3 days, and you don't need to come wait for me for 6 hours for me to tell you this in a minute so you can go home. You're saving the cost on transport, you're saving the cost on you leaving your work to come to ask me for this, you're decongesting the hospitals. So a lot of preventive medicine can be done from the phone. I want to know, I'm a student, I need such a productive health information. I don't know how to use a condom or something. You need to come to my clinic, which doesn't give you up 24 hours for me to tell you this. No, we believe that health professionals on the other end of the phone, on the phone can provide as much information that can change the landscape of health service delivery without them having to come. And of course, the scope of the information. Sorry.
I still have another question.
Why do you think we could be a good partner there in opposition to, for example, local operators?
Local operators, unfortunately, haven't really caught on to being able to provide the subsidiary products and services. Most of them are still very focused on fixed lines and data and so on. And yet there is this huge market just waiting for them to grow into it. So we are thinking of partnering with a telecom that already understands these principles and has already taken them on as a strategy, because in that way we can fill that space even faster than the local operators. They are totally, I mean, they do not have, the biggest chunk of their profitability is not coming from this area. They're going to focus, they're not focusing on emerging markets, they're focusing on their core business. So we are looking forward to partnering with Deutsche Telekom because they understand what we are talking about. That's how we flew all the way to Germany.
What do you have read in terms of maturity of the solution? Do you product line or do some
So what we have right now is a functional call center that has a basic EHR, that has a CRM, and also an IVR that we're also going to roll out. We also have a clinic which can provide services to those people that actually need to come in. So that there is immediate possibilities for engagement with patients.
how many doctors in this?
So right now we'll be running a 24/7 service with 3 shifts. Each shift will be 8 hours, and each shift will have 4 doctors and 2 pharmacists. But then we also, have some very interesting ideas about. We noticed that whenever we went to work, that patients kept on calling us outside our working hours, and we were not getting paid for that. We were providing valuable information, and we believe that there are many other healthcare professionals with the same problem. And what we want to do is to be able to provide them with that interface with our call center so that they can take the extra calls that we have so that they can handle those, and then we can get into a revenue sharing model with each and every doctor that has spare time to be able to provide the service.
More question? Yeah.
In your ecosystem, which parts of it do you envision to build in-house, and which do you think you can plug into the infrastructure? Do you have to build a clinic, do you have to buy all the ambulances, or can you somehow use?
That's a very good question. We're trying to stay as lean as possible and keep our costs as lean as possible. For example, with the ambulances, we notice that there are so many redundant ambulances because people haven't built a revenue model around the ambulance that they have purchased. What we want to do is get into a revenue sharing model, being able to equip their ambulance with the GPS tracking, fleet management technology, so we can have access to every single redundant ambulance in the region. So we don't have to buy 100 ambulances when there are 100 out there sitting doing nothing. And then we will be able to use that software technology to be able to call on the nearest ambulance, the best specialist ambulance, to get to the place that we needed to get. Same thing with the clinics, same model. There are so many small to medium-sized clinics that we just need an extra input to just get it to the level that we want to be able to use that as a referral point for most of the people that call it.
Very good. That sums it up. And thank you, Rob.